Let's check in now, though, with Andrew Lane, chair of the National Pharmacy Association, to whom I spoke just before we came on air, and I asked him about a vaccine, how close a vaccine could be after Jonathan Van Tam said yesterday the UK will only be out of this situation once there is a vaccine.
That's interesting, Darren. I think we've heard this a number of times now that we're not really going to come out of this bit like the common cold. I think last week we were told, and effectively the virus is going to be with us very much like the common cold for many years ahead, and it will mutate as you find already in certain strains of coronavirus.
But if it's like the common cold in the sense that there is also a treatment that renders it an annoyance, something that we just live with, oh, we've got a bit of a cold, that's a bit of a nuisance, rather than something that's potentially fatal, that wouldn't be a bad place to get to if we can combine a vaccine, if we ally that with a treatment in some way. Do you think that is a possible strategy?
Well, at this point in time, you're probably aware there is no treatment for the common cold. We can have a vaccine against the flu, and obviously we see different strains every year coming through for that. And obviously community pharmacies are involved, as you're probably aware, in the vaccination program for the flu. But I think the Deputy Chief Medical Officer said that it is going to be around, and I think it's going to change the way we interact. It's going to change the way GPs operate. It's going to change the way pharmacy operates in the community.
Well, let's get on to that in just a moment, but just a little bit more on the vaccine, because, of course, just a couple of days ago, Alok Sharma at the Daily Briefing suggested that we might be in a position where by September, 30 million doses of vaccine could be available here in the UK if the AstraZeneca and Oxford University trials continue to go well. Do you detect any justification for the optimism as far as those Oxford trials are concerned?
I think we've got to take the advice that we're being given at the moment, and I think if we can ensure a vaccine is available, then it will be how quickly can we roll that out into the population.
Let's talk about pharmacies then, the role that they play, because in normal times, if we can remember those, pharmacies do a lot of heavy lifting, and they're a little bit unloved, I think, aren't they, in terms of the day-to-day healthcare that they can offer. They probably, by mere dint of their existence, prevent a very great number of people from having to go to their GP in the first place. In the era of COVID-19, with or without a vaccine, how do you see their role changing, developing, staying the same?
Well, if we look at some of the data that we've been providing a little while back now to the government, that 1.6 million people a day visit a community pharmacy across the UK. We are an untapped resource, as you rightly say. That's a heck of a lot of people, and I think going forward we're still going to see people coming into pharmacies. That's not going to change. I believe that the GP service will change. We've found very early on that the GP service went into triage. It was quite clear that one way to protect the GP service was essentially to lock the doors and make sure their staff didn't get the virus, where we were open on the high street along with supermarkets. We were the heroes out there on the front line. And I think the public have got used to the fact that they can get an awful lot of care from their local pharmacy. And I think going forward, a lot of GPs I know have said to me that they actually will be doing a lot more telephone triage, a lot more Skype calls with their patients. And I think we will see pharmacy being the face-to-face of primary care, while GPs perhaps do a lot more work that secondary care sees now. We've seen a lot less people going to A&E, for example. So clearly those people haven't been going.
And it's worth just, of course, remembering, isn't it, that the same rules apply to pharmacies as they do to GP surgeries. If someone is displaying the symptoms of coronavirus, then they should not be turning up at their pharmacy any more than they should be marching into their GP surgery at this stage. So that notwithstanding, do you think that pharmacies are now getting the PPE that they require? Because community pharmacies just a few weeks ago said they were struggling to get hold of face masks. Are your members and those you represent and those people working in pharmacies properly equipped with PPE, do you think?
It's very interesting. Right at the beginning, the Secretary of State said that he'll do whatever it takes to keep pharmacy staff safe on the front line. And we need... And we've been saying this right at the beginning, we needed the PPE to our pharmacists and our pharmacy teams to keep them safe. And it's been very patchy. So early on, there were supplies from the NHS, and some of the areas of the country are still getting those supplies. Other areas, it's completely dried up. Depending on the network that you have in your locality will depend on whether or not you are getting any PPE. So it is extremely patchy across the country. I can say, for example, in Gloucestershire, there isn't a problem at all. In Oxfordshire and Berkshire, there is a problem. So, you've got to ask the question, what is the logistical problem that's actually stopping some of these parts of the country getting their supplies of PPE properly?
And just a couple of other functions that are performed by pharmacies, and one which is now being performed in lockdown, which we'll get to in just a couple of moments. But in terms of people's prescriptions, if someone is listening and they are concerned that they can't get to their GP to get a repeat prescription, presumably in many cases that can be done over the phone with their GP, and pharmacies will, of course, be alert to the need to refill those prescriptions. What sort of system is in place to help people that are concerned about getting hold of the prescription medicines that they need on a regular basis?
So people who are on medication for long-term conditions will inevitably have a repeat prescription from the GP. Most of those are now wired to a pharmacy of the patient's choice. It's all electronic, so we're geared up to receive those prescriptions electronically, and if the patients can't get in for whatever reason, they might be self-isolating, we will arrange for deliveries using the either existing delivery service or often in many areas of the country now, some of the volunteers.
And the other function I just wanted to touch on, which has the need for this has arisen or perhaps become sadly more apparent during and because of lockdown. This is in Boots pharmacies. Victims of domestic abuse can now seek help there. Safe spaces have been installed in consultation rooms in Boots. And this is an example, I guess, it is just one national chain, but nonetheless, it's an example of how pharmacies can really offer services above and beyond that which might be immediately assumed.
Absolutely. We've seen domestic violence growing with some of the issues that we've had around lockdown, and pharmacy has stepped up to the plate in an area perhaps that the public didn't think it would. And I think that is something that we will be progressing with the government going forward to see how we can extend that. I think there's a impetus to roll that out to a wider audience if that's required. Obviously it's not very good that we're in that situation, but it's a need clearly that's there. Pharmacies are stepping up and providing that service.